Nancy Pelosi, the Democratic leader, should be out shortly speaking with reporters about the agenda ahead. Just happened at the White House, Vice President Pence swearing in Nikki Haley as the new ambassador to the United Nations. The Associated Press reporting this morning that President Trump is asking for a review of methods for interrogating terrorist suspects and the possible reopening of a CIA-run black site prison outside of the United States, according to a draft executive order obtained by the Associated Press. And some reaction to that from Senator John McCain, the chairman of the Armed Services Committee, tweeting out, "President can sign whatever executive orders he likes, but the law is the law. We're not bringing back torture." That's from Senator John McCain. While we wait for Nancy Pelosi, we'll show you some of today's Washington Journal.
Washington Journal viewers are familiar with Steve Moore, an economist, author, visiting fellow at the Heritage Foundation. He joins us now to talk about President Donald Trump's economic and tax plans, and specifically a recent report in the Hill newspaper that the Trump team is considering cutting the federal budget by about $10.5 trillion over the next 10 years. Steve Moore, you wrote about this recently for the Washington Times, and you called it a $10 trillion stimulus plan. Why?
Well, good to be with you, John.
Here we are. Good morning, everyone. Good morning. I think we can all agree that few people have a more intimate understanding of the stakes of the healthcare debate in people's lives than America's nurses. As Republicans forge ahead with their plan to repeal the Affordable Care Act and make America sick again, it is my privilege to be joined by nurses from across the country who stand on the front lines of America's healthcare. They're here to share their stories that show exactly what's at stake if Republicans succeed in destroying the Affordable Care Act in America. It's my honor to welcome Vicki Gonzalez of Miami, Florida, Michael Collins of Las Vegas, Nevada, Kathy Stoddard of Pittsburgh, Pennsylvania, and Diane Palmer of Milwaukee, Wisconsin. It's now my pleasure to yield to Vicki Gonzalez from Miami, Florida. Vicki? And welcome all of our nurses who have joined us today. Thank you all so much. Thank you.
Thank you, and good morning, Speaker Pelosi. My name is Vicki Gonzalez, and I am a wound ostomy nurse at Jackson Memorial Hospital, Florida's largest public hospital. My heart is overjoyed when our patients get the care they need. Not too long ago, Jackson Memorial's emergency room was consistently flooded with individuals who lacked health care coverage and relied on emergency medicine for primary care. We can't turn them away, but emergency medicine costs 5 times more than a visit to the doctor's office. Far too often, uninsured individuals can't afford out-of-pocket charges that can easily exceed a month's rent. But with more patients covered and more of a safety net, my hospital can invest patient care dollars wisely. More patients have access to care regardless of pre-existing conditions. If Congress forges ahead and takes health care away from millions of Floridians, people throughout South Florida will be forced to rely on our emergency room services once again, and we'll go back to being in the red. Miami's robust entrepreneur community may not be able to afford whatever Republicans in Congress propose as an alternative. Of course, our taxpayers will shoulder the burden too. To paint a picture of how critical affordable care is to Miami-Dade community, just this month, a Miami Herald story showed that 3 congressional districts in South Florida have the highest number of people who purchase care on the health exchange in the nation. Clearly, patients need that care. We need Congress to put a real plan in place that ensures hospitals and healthcare professionals can serve our patients and our communities with the quality of care they need and deserve, not less. And now I'll introduce Michael Collins, registered nurse from Las Vegas.
Good morning.
Good morning.
Thank you, Speaker Pelosi. My name is Michael Collins. I'm a registered nurse at University Medical Center in Las Vegas, Nevada. University Medical Center is the only burn care center in the state of Nevada. It has the only level 1 trauma center in the state of Nevada and provides the only renal transplant center in the state of Nevada, and that's where I work. Before the Affordable Care Act, our hospital was chronically in debt to the tune of at least $180 million every fiscal year. We're mandated by state law to treat all who come to our doors, regardless of their ability to pay. Since the Affordable Care Act, we've been able to provide services and extend our outpatient services because we have turned a profit of over $35 million in the last 2 years. Now, with the repeal of the Affordable Care Act, more than 371,000 Nevadans stand a chance of losing their health care coverage. The leaders of the Republican Party are talking about taking away the Affordable Care Act, but there's no plan in place to replace it. I would like to know how they will keep deductibles and out-of-pocket cost low enough that our patients can continue to access our coverage in their proposed plan. Since all of the patients that I work with have pre-existing conditions, can my patients count on coverage and not just be thrown to the side? Where will the chronically ill and injured patients that we see go when they're sick and unable to work and Medicaid has been slashed? Before rushing to rip apart a health care delivery system, President Trump, Republican Congress, owe us a real plan to make it better. My patients and all of our lives depend on that. Please, do not take our health care away. Now, my colleague, Kathy Stoddard.
Good morning. Speaker Pelosi, I'd like to thank you for working on behalf of millions of our patients. My name is Kathy Stoddard, and I want to thank you for this opportunity to speak in front of you today and tell you how the Affordable Care Act gives patients, families, including my own, health security and financial peace of mind. I'm a staff nurse at Allegheny General Hospital and a quality lean coach. The issue of pre-existing conditions impacts me not only professionally, but personally. You see, my son was born with a heart defect that required life-saving cardiac surgery. Our insurance did not cover all that was needed to diagnose and treat him, but not giving him the care he needed was not an option. We ended up putting his heart catheterizations, echocardiograms, and doctor's visits on credit cards. We always paid what we could, but those charges mounted and medical bills mounted, and after years and years of becoming more than we could ever pay in several lifetimes, we had no choice but to file bankruptcy. Any mother out there can tell you we never stop worrying about our children. My son is a college graduate, a registered nurse, and he can afford his own insurance, but like millions of others, he could have it taken away because of his pre-existing condition. As a mom and a nurse, I am very selective about how I spend the very little extra time that I have. But I am making sure that affordable health care is protected and expanded. Making sure that it is protected and expanded is hugely important to me. And I will devote as much time as I have to making sure that those individuals, including my son, have the health care coverage that they deserve. I cannot see a world and an America with our patients being harmed because they have pre-existing conditions and are barred from the care that they need. My fellow nurses and I are determined to ensure that no family will ever have to go without the kind of experience, that my family had to. Patients deserve access to quality, affordable, safe health care. I would like to introduce a registered nurse, Diane Palmer, Chair of the Nurse Alliance and Vice President of SEIU. Diane?
Hi, I'm Diane Palmer. Thank you, Speaker Pelosi. As chair of the Nurse Alliance of SEIU Healthcare, I am here today representing 85,000 nurses who work directly with patients and families in hospitals, community-based and public health settings. Together with our SEIU sisters and brothers, we fought for comprehensive health care for decades, including the expansion of Medicaid that has helped 22 million Americans gain health care, many for the first time. Now, President Trump, his corporate cabinet, and Republican leaders in Congress want to take away health security for 30 million hardworking women and men and their children and grandparents, and send our healthcare system into crisis. I'm here to say that nurses will not let that happen. Republicans need to present a real plan that will show how they plan to make quality health care more affordable and to ensure that no one who has care today loses that care. We nurses will be ready to ask the hard questions needed to make sure any proposal that is offered doesn't take away care that Americans are counting on, doesn't increase health care costs for hardworking women and men, doesn't allow corporations to drop coverage for their employees, doesn't raise taxes on the middle class, doesn't risk care for seniors, children, and people with disabilities, and doesn't leave our patients to fend for themselves. Thank you.
I thank our guests for their presentations, the testimony that they have given us. I thank all of the nurses who are here for the service they provide, the leadership that they give us, telling their stories across the country. When we passed the Affordable Care Act, the nurses across the country were an important part of our pushing open that gate that was a barrier to passing the bill. I thank you for that. Vicki, thank you for making it clear how much more expensive emergency care is. Michael, that every one of your patients has a pre-existing condition. Kathy talking about her personal story as well as her professional experience with a pre-existing condition and the cost and the debilitating impact it can have on a family to have a pre-existing condition and not have the health care the health insurance that they should have. Thank you for that, Kathy. And Diane, thank you for emphasizing Medicaid, because that's so important to the Affordable Care Act. People don't understand that Medicare, Medicaid, and the Affordable Care Act are now wedded together. If you overturn and repeal the Affordable Care Act, you have a negative impact on Medicaid at a time when people need it more than ever. The Medicaid is not just about helping working moms, lower income working moms and families be able to work and have health care for their families, not only about seniors. 50% of the cost of long-term care in hospital in facilities is paid for by Medicaid. Medicaid for that working families, Medicaid for our seniors, middle-class seniors who have paid down their assets. Our nursing homes, Medicaid is there for them, so everyone is affected by it. And of course now with the opioid, as one example of a crisis, the Medicaid, the governor of Ohio, Governor Casey, said, thank God for Medicaid, in fighting a Republican governor of Ohio. So that is so very, very important as well. The power of the stories that you have told is multiplied by the statistics and the facts. The facts, the real, true facts. Last week, don't take it from me, the facts coming from the Congressional Budget Office, whose director is appointed by a Republican speaker, stated that repealing the ACA will double premiums for Americans in the individual market by 2026, would increase the number of uninsured by 18 million people in the first year of enactment, and surge to 32 million people by 2026, the Congressional Budget Office. You've mentioned the situation with hospitals. Hospitals will also be devastated, Michael talked about this, by ACA repeal, because they would be left with uncompensated care to the tune of billions of dollars. You know, hospitals are the one entity where you have to provide care if someone comes in, even if you're not compensated for it. And the Affordable Care Act addressed that creating jobs and opportunity in areas. Someone told me a story yesterday of a hospital that's going to have to close down if the Affordable Care Act prevails, if they don't have Medicaid and the uncompensated care part of it. How do you attract business to a region that doesn't have a hospital? When we're talking about the vitality of rural America, you have to have human infrastructure as well as physical infrastructure there. Hospitals, again, would be devastated because they'd be left with the uncompensated care. The resulting job loss with funding cuts would bring economic harm to the communities, and it would increase the deficit. So, narrow access, increase cost, and reduce benefits, cut jobs, and increase the deficit. Repeal would kill nearly 3 million jobs, not only in healthcare, but in every sector affected, from construction to real estate to retail. This weekend, perhaps you were there, 10 of my family members marched, both in East Coast, West Coast, some in Washington, I with more members of my family in San Francisco, into the driving rain, but it did not dampen anyone's spirits. And the more it rained, the more vocal we became about vote, volunteer, run. This weekend, millions of Americans gathered across the country in an awesome, peaceful show of power in support of women's rights and women's health, among other things. Last Friday, January 20th, we saw the peaceful transfer of power, inaugurating a new president. The next morning, America awakened to peaceful show of power, where women across the country, indeed across the world, turned out in the millions in crowds that dwarfed the inaugural crowds. On days after, the President and the Republican Congress launched a major assault on women's access to comprehensive health care, not only here in America, but around the world. On Monday, the Trump administration reinstated the global gag rule that silences even the discussion of women's reproductive choices. Yesterday, House Republicans passed an expanded and even more dangerous version of the Hyde Amendment that would restrict how women with private insurance can spend their private dollars in purchasing health coverage. So here we are, and then, of course, they have begun their repeal of the Affordable Care Act. And the facts are these about that. Not only is it about the 20 million people who we proudly and take great pride in saying at least 20 million more people have access to health care, but 150 million people who get their health care coverage in the workplace. Under the Affordable Care Act, 150 million people, in addition to the 20 million, and their families, will no longer be, under the Affordable Care Act, no longer be subjected to lifetime limits or annual limits on their care, no longer be subject to discrimination because of a pre-existing medical condition. Their children can stay on their policy until 26 years old, and back to the march, no longer will being a woman being a pre-existing medical condition. The American people are waking up to the nightmare of what Republicans have planned for the health care of women, seniors, and working families. Democrats will stand our ground to defend the Affordable Care Act because we believe, I think we can all attest, that we believe that health care in America is a right for everyone, not just for the privileged few. I thank again the nurses for joining us today and for your leadership in caring for America. The testimony that you bring is intimate, it's personal, it's policy, it has policy ramifications. You help us make the case, and we're very grateful to you for that. Thank you so much. Thank you all. You may want to step aside when I have to take questions on some other subjects. But first, let us, again, I thank you for coming. We'd like to confine the questions first to the subject at hand. Yes, ma'am.
Yes. Leader Pelosi, there are, yesterday, Senators Cassidy and Collins put out a plan for replacing Obamacare, the Patient Freedom Act of 2017. And in that, they even say that states could keep the Obamacare exchanges if they want to. And also, Rand Paul has put out a plan to replace Obamacare, and I keep hearing that there is no plan to replace it. Do you stand by that?
Well, who's in other words, what others have said on the Republican side of the aisle is that I believe even the chairman of the Help Committee, Chairman Alexander, that they really can't act unless they see something from the President of the United States, his proposal. So while individuals may have some suggestions, we have to see what is their proposal. What we have said as a standard is that the goals that were set by the Affordable Care Act were to improve quality of care, expand access, and reduce cost. Any proposal that they would present would have to stay on that course, which the Affordable Care Act has been very successful in achieving. So when we see something, we can, obviously, if they have a good idea, we'd like to hear what it is, and we'd like to work together. But right now, we are fighting the repeal of the Affordable Care Act in the absence of one of the plans you didn't mention, but one of the proposals of the nominee for HHS, Mr. Price, was to give a $3,000 tax credit, is it? And yesterday, a couple days ago in the Budget Committee, the Urban Institute testified that under his plan, America's families would be subjected to a $50,000 deductible, individual $25,000 deductible. So there are a lot of things out there. I don't know who's speaking for what, but even the chairman of their committee has said that they want to see something from the president. Yes, ma'am.
Leader Pelosi, Donald Trump this morning tweeted that he's going to be calling for a major investigation into voter fraud. What is your reaction to that?
You know, there is no evidence to support what the president has said, and I think we made that really clear to him in our conversations with him. But I'm very pleased that our colleagues, Mr. Cummings, Mr. Clyburn, and who else? And Brady, the ranking member on the House Administration Committee, three leaders in the Congress, have sent a letter to all of the attorneys general across the country, any place that votes for the president, and including the District of Columbia, and saying, give us the names of anyone that you suspect is guilty of voter fraud. Because the fact is that it's so. Let me just say another way. When Jill Stein was making her case about voter irregularities, wanting to have, following the election, the lawyers for Donald Trump testified that there was no voter fraud to justify her request for a recount. So that's kind of where that is. No, it is, for a person who is the newly elected president of the United States to be so insecure as to declare that he's now the president, he's ensconced in the White House, and he's saying, I won the popular vote, and 3 to 5 million Americans voted illegally in our country, to suggest and to undermine the integrity of our voting system is really strange. But in addition to that, on top of it, he wants to investigate something that can clearly be proven to be false, but he resists any investigation of the Russian disruption of our election and any connection to his campaign. All we want is the truth for the American people. I frankly feel very sad about the president making this claim. I felt sorry for him. I even prayed for him. But then I prayed for the United States of America. Any other questions? Yes, ma'am.
What is your response to the anticipated executive orders from President Trump on immigration and refugee resettlement?
Well, we haven't seen exactly what everything that he's going to do. I think he's going to Department of Homeland Security today, and we'll see we hear rumors of what he might say, but I have always opposed any policy that excluded people on the basis of their religion. And many of the refugees coming to the United States from Syria who might be Muslim, which is part of this target, are women and children. And I don't know that that's what the American people really think is our value system. However, some of what he says will have its popular appeal because the immigration was an issue that he fueled the flame in his campaign. Let's see, just a minute. Is any of you guys who are on the trail, on the beat? No? Okay. Yes, ma'am.
Leader Pelosi, are there divisions among Democrats right now between people calling on leadership to work as well as they can with Republicans versus people pushing Democratic leadership to be more liberal, especially after the losses that the party took?
No, there's not a division. No, we have said if the Republicans, obviously we pledge to the American people a responsibility to find common ground with the Republicans, as we did with President Bush. Even though we disagreed with him in the war in Iraq and privatizing Social Security and won at the polls opposing him on that, when we came together afterward, we worked together on many issues. We stand ready to do that. Where if they want to have a real infrastructure proposal, not a tax break for wealthy people disguised as an infrastructure proposal, they want to talk about home and family and work balance, which they spoke about in the campaign. We look forward to working with them. As I said in opening day, gavel speech, as I gave the gavel to Speaker Ryan, and other issues where we might find common ground. But when we don't find common ground, we'll stand our ground on the Affordable Care Act. We are standing our ground, but there's no division. No.
Democrats, on President Trump's announcement to freeze federal hiring, do Democrats have a plan to fight that? And specifically, how does it affect the VA? Because I know that lawmakers have been working on a bipartisan level to staff that agency up.
Yes, the freeze on hiring, which it was really unfortunate, because what that is to say we don't believe in the government role to meet the needs of the American people. So when they attack the workers, they're attacking what they do, making sure people get their Social Security checks, meeting the needs of our veterans, Medicare, the list goes on and on. And so when they did this freeze, they said we exempt national security, but that did not include veterans. So right now, one of my colleagues has said in the hospital in his area, Veterans Hospital, they were hoping to hire 3 cardiologists, which they cannot do now because there's a freeze on hiring. They can't hire people who give you the scalpel. You know, it's not only the cardiologist, it's the people who assist in providing health care for our veterans as one example that is wrong. But it's always been part of their kind of agenda to say, we want to reduce the federal workforce so we can privatize a lot of the services, then we don't have to honor any value of diversity or workers' rights and the rest of that. So I think that they will see some bipartisan opposition to what they are doing, because many federal employees work in the districts of Republicans as well as Democrats. But this is an assault on doing our job for the American people, but it is not any surprise. Yes, ma'am. On that subject?
Back to HR. What do you say to your Catholic constituents who may be relieved to no longer know that their tax dollars will go to fund abortions?
Let me just say this. I'm a Catholic. I have 5 children in 6 years. Anybody have standing on the issue? And I think that there has not been taxpayer dollars spent on abortions. You know that. So this is fraudulent. It's fraudulent, and what they're doing is making it more dangerous so that people can't spend their own dollars in the exchanges to have access to reproductive rights. So we will fight that, and my constituents support that. Yeah.
Have you talked to Congresswoman Gabbard since she got back from the
No, I haven't. I haven't even seen her.
Well, what kind of message does it
I
send?
haven't seen her. I don't know. I have no knowledge of the trip. Just we've been very busy. I haven't seen her. So
You don't have an opinion on a lawmaker taking a trip like that without even giving you guys a heads up?
I don't know any of the particulars of it. I don't know the basis of the invitation. I don't know the auspices under which she went. I don't know, and she hasn't reported anything to our office as far as I know. So when I know more about it, I'll have something to say about
Leader
it.
Pelosi, on these gag orders that have been issued to EPA, in terms of it speaking to the media, but also the withdrawal of some climate references, taking down climate change pages on the EPA site. Are you aware of these actions that are going on in the administration, and what can Democrats do about it?
Well, what can the American people do about it? You know, there has always, we have said, and I said in my opening day speech here, if you want to silence our voices for common sense gun violence prevention, we will fight that. You cannot silence people's voices. And it is a deterioration of intellectual resources to prevent information to flow. That's what has made America great, that we're open, we listen to ideas, we exchange them, and any country that doesn't does so to their own detriment. So I would hope that the press would be a very important part of calling out how unfair this is to even have information available to the press, because I do believe, although we don't always agree on your coverage, as President Obama said, that the true guardian of our democracy is the freedom of the press that is in the First Amendment. That is the most important freedom, because that says we can speak, people will know truth and freedom. Truth will set us free. And so what they're doing should be just appalling to people if they knew about it, but they shouldn't be doing that.
Intend to send a letter to the administration or otherwise?
Well, we'll see what we'll do. I mean, do you think they care about a letter? I think it's more about public sentiment. As Abraham Lincoln said, public sentiment is everything. With it, you can do almost everything. Without it, almost nothing. So it's about public sentiment. They probably wouldn't even respond to a letter because they don't want information. They want information. We were chatting earlier this morning. I was saying that George Bernard Shaw once said that a true sign of a truly intelligent person is that he or she is, he said he, is swayed by statistics. And so they seem to be happy to be in a fact-free zone where even their own Republican, and I did ask the president to read the CBO report before we could talk about the Affordable Care Act. So we've always had, dealing with President Bush, dealing with the Republicans across the aisle, we've always had sort of a, I don't want to say tradition, but a standard where you agree to a set of facts or some numbers or a baseline, and then you go from there. We respect each other's opinion. We respect the position that some might have, be more conservative, more progressive. That's the American way. But at least when you try to negotiate, you're dealing from a set of facts instead of being in a fact-free zone or whatever they want to call their version of reality.
Yes, please, along those lines, you've met the president a couple of times. We've seen a few days of the new administration. Do you have any new ideas on how you will confront them? Has your thinking evolved on that at all?
Well, it's interesting because I saw him at the inauguration, and we had a chance to chat at the White House coffee or tea, whatever, before we came to the Capitol, and talked about how we could find common ground on infrastructure, and I hope that that is the case. Then the invitation for the leadership to come to the White House and bond, I guess is probably what it was welcome. And because, again, we don't have to agree on everything to agree on some things, right? But it was really quite startling when the president declared that he won the popular vote because 3 to 5 million people voted illegally in our country, which was not fact-based, and evidence-based. But in addition to that, I had the impression that he was saying, Carolyn, that didn't even include California. So again, we have to stipulate to a set of facts if we're going to talk about infrastructure, if we're going to talk about child care, if we're going to talk about early childhood education. We have to stipulate to those facts. I did tell him that when as I mentioned earlier, we opposed President Bush, but then when we won and he was still president, of course, we worked together on biggest energy bill in the history of our country. He wanted nuclear, I wanted renewables. We had a big celebration at the signing of the bill. When we talked about PEPFAR, he wanted PEPFAR, we wanted it large. He's very proud of that, and he should be, he and Mrs. Bush, on their leadership on that HIV/AIDS drug legislation, in case you don't know what PEPFAR is globally. We worked on TARP, which is the hardest vote that I've ever asked our members to vote on. It's his proposal. We added things to protect the taxpayer in the legislation, and I really think that the TARP bill is probably what has caused a lot of anger in the public, because it appeared that we bailed out Wall Street at the expense of Main Street, but that was not the case. But that's the appearance that it had. What else did we work with him on? What Barney Frank said was the most liberal bill in terms of the taxes, working with the president to, I wanted a recovery path, stimulus. He said, I wanted infrastructure. He didn't. He said, I'll do tax rebates or whatever. Said we can do that as long as they're refundable to low-income people. We have one of the most progressive bills in history, and it set a standard for how we go forward for that. So you can disagree. What could be worse than the Iraq War? I mean, you can disagree strongly on one subject. What could be worse than privatizing Social Security? But have agreement on other subjects, and that's what we hope to do with this president, because we have that responsibility to find that common ground if we can, to stand our ground if we can't, but also to just stipulate to a set of facts as we go forward, because if we don't, there's absolutely no way you can come to an agreement that has legitimacy and is valid for the American people. Just one more. Who shall it be?
Order, draft executive order where President Trump is asking for a review of America's methods for interrogating terror suspects and the possible reopening of CIA-run black sites, as well as the order would reverse America's commitment to closing the detention facility at Guantanamo Bay. Could you speak to that, your reaction?
Well, I think that this would be a step backward, and I'm not alone in thinking that the path he's going down is wrong. It is not about our values as a country, and don't ask me, just ask John McCain and others. Any reverting to that, again, does not support our values, but also endangers our people who are there, whether it's from a security standpoint, intelligence community, or in the military. So I just think that it's wrong, and I hope that he will rethink it, and I hope he will listen to even some Republican leaders on this subject. The intelligence community, we owe them so much. They risk their lives. As you know, you may not know, but involved on intelligence since their mid-90s, some longest serving person as a member, but ex officio as well. And while we have some disagreements from time to time, largely springing from the administration and not from the community, I have any chance I get to praise them for their work, and I think this would endanger them and what they are doing, as well as their own military, if we were to say that this is what we think is civilized human behavior. Thank you all very much. Thank you. Excuse me.
The nation's governors are also meeting in Washington. We'll hear from the chair and the vice chair of the National Governors Association, Virginia's Terry McAuliffe and Nevada's Brian Sandoval. Their briefing coming up in about 10 minutes at 11:30 Eastern. We'll have that live here on C-SPAN.